We're setting up on Facebook. It says that we're being live streamed, but we aren't sure. And now Facebook has informed me that we are in fact live. Hello, everyone. My name is Dr. Jennifer Gardella. I am very excited to be here on the BCHIP Facebook page with you today with the Executive Director of BCHIP herself, Kimberly Everett. Kimberly, we are thrilled. Why am I calling you Kimberly? I always call you Kim. Kim, we are thrilled that you are here doing this work for the community, and really thrilled that we have absolutely no reason to doubt you work for BCHIP with all of the BCHIP that you have around you today.
You've trained me well around branding, my friend. Trained me well. Yep.
Oh, there you go. So Kim, we don't want to waste a lot of time. We know everybody's time is valuable. Why don't you go ahead and explain what BCHIP does? Because it has a really interesting set of areas that it helps our community.
I appreciate that. BCHIP is a really unique organization. It started over 28 years ago when the competing hospitals at the time said we should work together to address gaps in healthcare in our community. So although they are, technically competing organizations, they still, after all these years and after being part of larger health systems, are really committed to the health of Bucks County and working collaboratively to address gaps in healthcare. So we have several different initiatives that have been stood up over the years. I think the few that we'll talk about today, there's many we'll spend some more time talking about in the future, I hope. But the three historical programs that come to mind right away are, we have a grant provided through the Health Promotion Council to provide smoking cessation classes in the community, as well as at our 6 community hospitals. So we use an evidence-based program. Folks can join virtually, or we have live classes. And it includes nicotine replacement therapy, so they can get gum or lozenges or patches. And it's for 5 sessions. And it kind of gives them the skills to try to consider quitting smoking. But one of the messages we really always want to make sure people know is that you don't have to be committed to quitting. If you just want to learn some information and learn about it, and we hope that maybe by the end you'll try to at least decrease your smoking, but not everybody's always ready to quit. So we just want folks to be able to participate and learn about the resources that are out there.
Okay, that sounds like a really good one. I mean, I work with you guys on a lot of those campaigns, and smoking is something that people should try to at least get under control. What I love about what you just said is that it's not going to happen. Many times it doesn't happen cold turkey.
Exactly. And we have some folks that just like the camaraderie of the group, so they'll participate. Even if they've quit, they'll come and they'll do it again. And that's okay. We have no objections to that. As long as we're finding value, we're bringing value to the group. So, yeah.
Awesome. Okay. Smoking cessations, number 1, stop smoking. You come see BCHIP. What's number 2?
So another one is our advanced care planning program. And this one's pretty interesting because this is about people completing their living will or their healthcare agent or healthcare power of attorney forms. BCHIP doesn't do financial wills or financial power of attorneys. However, we really want folks to have the care that they want should they not be able to make decisions for themselves, or should they not be able to communicate themselves. And so there's a lot of resources in the community to do this work. And interestingly, it's one of those things that when you look at the data, the majority of folks think you should have these documents completed, but the majority of those folks don't actually have them completed, right? So talking about end of life isn't a real fun topic. It makes a lot of folks very uncomfortable. But the reality is none of us live forever, right? And so having lots of personal experience with that lately, and trying to just make sure that the people that you care about receive the care that they would have wanted. And we know sometimes that can be a big challenge for families, that families in those emotional times can have arguments and disagreements and not agree with what care mom or dad would have wanted, in these circumstances. And not all families have, good relationships to start with and good communication skills. And so what this program is, we call it a gift to your family, right? Because if you won't do it for yourself, maybe you'll do it to avoid all those challenges for your family, especially at a time when things are emotional, right? So we try to have folks do it when it's not an emotional time. And we think everybody should have this form. If you're over the age of 18, we think you should have this form. So it's not just when someone becomes sick.
Right. I bumped into, my daughter was starting Westchester University, and I bumped into a mom. She was transferring her kid in from Alabama, and he had had an appendicitis. He had his appendix ruptured while down in Alabama. She did not have these forms, and she could not get any information about his care until he woke up and authorized the forms in the hospital. So if you have kids in college, if you have kids that are even older and not married, or they are married and they still have to get all this together, you lose a lot of rights after people are 18 years old, even if you are paying the health insurance bill, which a lot of parents are shocked about. Like, I'm paying their health insurance. Why can't I get access to my kid who's in the hospital? It doesn't work that way.
The best way I've always described doing this is I had a friend of mine do it, and we had her parents, herself and her husband, and her adult children with their significant others. They were fiancés, and we had an hour conversation before an Eagles game on a Sunday where we passed out all the forms, and we had everybody read them and talk about it. Everybody heard what everybody else would have, once, should they have those circumstances. It was a great conversation. There was a couple tears, but there wasn't anything extremely dramatic or emotional about it.
Right.
And then we were able to collect those forms. And then what BCHIP does too is, if the client wants us to, and only if they want us to, we'll give copies of those forms to anybody they ask us to. So meaning their healthcare agent, their family, their doctors, the hospitals of choice, specialists. We make all those copies and distribute them for free.
That's great. And I love what you said, that it's a gift, because there is a lot of fighting that goes on. And we saw that at the end of the show. Of course, I tried to bring it up. No, This Is Us, where the mom had Alzheimer's, advanced stage Alzheimer's, and she informed her children who was going to make decisions for her. First, it was the stepfather, her husband, and then it was the daughter. And everyone had to adjust to it, and they all got mad. Right.
Yeah.
But it was important to do before something had to be decided. I always joke with my kids, I am one that wants to be kept on a respirator for the rest of my life, and they are kids that they'll probably pull the plug to, plug in their cell phones. So like those I'm glad that I have my stuff in order, because it is my life. So that's important to understand too.
So we're very fortunate those services are completely free. And so there's no cost at all. It is a legal document. We witness it with 2 witnesses here. It does not need to be notarized in the state of Pennsylvania. So it is a legal document. So when the folks leave, as long as they're able to complete the document, make their decisions at that time, they leave with a legal document that is completely free. And so they don't have to pay, high fees for legal fees or legal services, a little bit different than when you do a financial will.
Yeah, that's great. Okay, moving on. The third thing you do.
The third large program that we have right now is our immunization program. So we complement the health department and what they do, but we lead the home care, or the home visiting program. So if anyone is a homebound person and really cannot get out of their home due to health reasons, then we are able to bring in COVID or flu vaccine to their home. Again, no charge for that service. And then we also do a lot of programs with our senior centers, our senior living facilities, or any other group that would like us to. We can come to churches, and we can bring flu or COVID vaccines on site in our community as needed. There's a lot of resources for those now, right? We went from everybody fighting on who was going to get a COVID vaccine to now having, COVID and flu vaccine everywhere. So we have it in our drugstores, and we have it in our grocery stores, and we have it. So there's a lot of places you can get it, especially now, just recently, that it's privatized. But we want folks to get those vaccines. We want older adults particularly to get their shingles vaccine, their pneumonia vaccines. A lot of times when people think of vaccination, they think of little kids. And that is important. And we do want our kids to have the recommended vaccines. I think that unfortunately COVID has caused some vaccine hesitancy, particularly on vaccines that we know and have been proven to be safe for many, many years that prevent disease. So we want to continue to have our children get vaccines, but there's also a lot of vaccines for adults that the people just are not aware of that are available. There's new legislation that passed that is covered by all Medicare or Medicaid insurance plans. Okay. We do a lot of work to try to promote immunization education in the community, and then address those targeted communities with immunization needs as they're identified.
Great. That's a lot of services you guys provide. No wonder why you're always hustling over there. I think one of the best quotes I ever heard about BCHIP was at your recent event. And someone said, the reason when we have a health crisis or something that needs to be addressed here in Bucks County, we don't need to put together a special task force. We already have Kim and her staff at the helm, who's ready to get, rally the troops to gather around keeping our community safe. So it's a real benefit that we have to you here.
Thank you.
How do people get in touch with you?
So BCHIP can be reached at our website, which is BCHIP, BCHIP.org, or our phone number to reach us. Let me check.
Do we know phone numbers these days? That's who knows?
Well, we just moved offices,
That's
so
true.
we just got new phones. So that's why I don't know it by heart yet. Sorry.
I don't know anybody's phone number.
267-291-7882. That's the main number to BCHIP for any of the services we talked about today.
Great. So if you want to stop smoking, if you need help with your advanced healthcare directives, and if you need support with immunizations, call Kim and her team and they'll help you out here in Bucks County.
Thanks, Jennifer.
This was so easy. Okay, we're going to stop the live stream now and we will see everybody later.